Hi, this is Dr. Deepika Krishna, fondly known as Dr. D, and today we are going to take up some questions related to PCOS. So let's shoot.
Hi Dr. Deepika. I have started to grow facial hairs over the past few years and experience irregular periods. Some testing showed my testosterone level are higher than normal too. Could this be PCOS? What treatment options help manage symptoms? Asked by Megha, who's 21 years old.
Okay. So firstly, Megha, as you know that PCOS generally occurs, it has been, most of the time it is seen when, during the age group of between 16 to 25 and to 28. So you are among the highly susceptible, age group of PCOS, and the symptoms which you are telling me, facial hair and your increased testosterone, it might, it directs towards PCOS. It can be PCOS. However, firstly, I would like you to, change your lifestyle, improve your food habits, eat healthy, nutritious food, eat lots of green, that is the best you can do, and get good quality sleep and avoid certain kind of stress. If that helps you, then definitely you can manage on your own, and if it lasts for a longer period, then you can seek a help of a medical consultant.
My periods are infrequent, I gain weight easily and struggle to lose it, and I have acne breakouts and constant pelvic pain before my cycle. Do I display classic PCOS signs? Are my fertility or future health at risk if I don't treat it? Asked by Rithi, who's 31-year-old.
So firstly, do not worry about so much, definitely everything has a treatment, and particularly if you doubt that you have PCOS, which, just having acne and pelvic pain doesn't indicate that it's PCOS. We need to have more testing, we need to get more testing done to get through a thorough understanding. So firstly, do not overthink about any major condition. Secondly, have some magnesium, have some good iron if you're feeling extremely exhausted and you're having pelvic pain or certain kind of uneasiness. Magnesium does help in these kind of situation, and if the situation lasts for a longer time, you know what to do.
My ultrasound revealed numerous small cysts on my ovaries, and I was told I may have PCOD. Is this the same as PCOS? Are these cysts expected to resolve on their own, or do they signify something serious?
Okay. Firstly, I will appreciate you being aware of your health and getting the ultrasound done. I hope it has been recommended by a doctor. Now, it's very important to understand the difference between PCOD and PCOS. I hope you go and check out my detailed episode, which the link is attached here, about PCOD and PCOS. In short, PCOD is polycystic ovarian disorder, and PCOS is polycystic ovarian syndrome. A syndrome is when it is a complication of a lot of other problems. The disorder can be managed on your own as well. Yes, whoever has told you it can be diluted, it can be dissolved on your own, it is true. A lot of this situation, if the cysts are not many, it gets dissolved on their own by taking care of good nutrition, good lifestyle, good sleep, and following a healthy routine. However, if the situation lasts for longer, or it has been overlapped by other problems like gaining weight, facial hair, HbA1c variation, then you need to immediately take action and work on it with the health profession.
I was recently diagnosed with PCOD after years of irregular cycle and weight gain. Dr. Krishna, is it possible for oral contraceptive pills or dietary changes alone to treat my hormonal imbalance? Please advise on expected outcomes. Asked by Simi, who's 35 years old.
Okay, Simi, so oral contraceptive is a very usual prescription which is prescribed in this situation. However, healthy lifestyle and good eating pattern does support it in a lot of better way, and also one should take care of the nutrition needs which are sometimes not being fulfilled by the daily food. So in this situation, I would say to get a one-on-one consultancy with a doctor or health professional, because we need to understand more reports. It is just very little what I'm able to know right here. So I hope we get to see more reports so that we can work on this in more detail.
My relative has PCOD, and I was reading up on potential long-term health risks like diabetes and endometrial cancer. How can we prevent the progression of this condition? Are there any alternative treatment you recommend alongside prescription medicine? Asked by Nidhi, who's 56 years old.
So Nidhi, PCOS and PCOD, they they come up with these kind of complications like you already mentioned, endometritis, endometrial cancer, diabetes. All of these problems happen later in life if one is not able to treat the PCOS or take control of the PCOS right at time. That is why so many times we feel okay, ठीक है, PCOS है, कोई मेडिसिन ले लो, doesn't matter, हो जाएगा, देख लेंगे. But later in the life, once you are in your early 30s, then the problem really starts to show up, other than the facial hair and the weight gain. Then one really deals with a lot of problem with reproductive system as well. So to avoid the situations like this, we need to work on your health immediately. So I hope these answers were helpful to you. So please see that PCOS and PCOD requires immediate intervention, immediate attention, so that we can avoid any bigger problem later. So do not keep it on shelf and be laid back and just pop up medicines of facial hair and weight gain and etc. etc. Address the symptom in deep. You do not require a crash diet. What does you require is a proper, well-planned lifestyle management. That is what you require. I hope this session is helpful. Thank you.